On behalf of the Ministry of Health, it is a pleasure for me to welcome all of you to this important press conference. This press conference seeks to give clarifications and updates on the recent health professional recruitment that was done. And so we are happy that you are able to come. We thank you so far for the support that you have given to us, and we hope that the information press conference seeks to give clarification and also update us on the recent health recruitment that was done. And so this morning, we are happy that you are here, and so far we thank you for the dissemination that you have been doing for us. At this point, let me introduce to you our directors from the ministry who have joined us to give us the updates and also answer some of the questions that will be asked. I have here Director in charge of the health training institutions in the person of Mr. Tony Goodman. And then we have here Elijah in charge of IT. Good. And then we also have here Director in charge of HR, Mr. Frederick Echampong. He's also here. And then Acting Chief Director, he's also Director Admin, Mr. Frank Raja. Thank you so much for being here this morning. So at this point, it is an honor for me to invite our Director HR, Mr. Frederick Echampong. A round of applause for him, please.
Good morning, ladies and gentlemen of the media, distinguished guests, colleagues. On behalf of the minister, I warmly welcome all of you to this press conference and thank you for honoring our invitation. Today's engagement is aimed at providing clarity, updates, and important information on matters concerning our recent recruitment. We appreciate the critical role the media plays in informing the public and ensuring transparency and accountability in governance. It is therefore important that we continue to engage you openly and constructively on issues of national interest. This press conference is aimed at addressing key developments, ongoing interventions in the recruitment regime of the Ministry of Health. The Ministry of Health wishes to update you on the general public and the general public on the ongoing recruitment process of health professionals that took place across the country recently. To give you the background, in April this year, the Ministry of Health received financial clearance to recruit about 8,000 health professionals from the Ministry of Finance. The Ministry acknowledges the anxiety and interest this recruitment exercise has generated, particularly given the backlog of about 105,000 unemployed health professionals, ranging from some having the last recruitment in 2019, some 2018, and particularly for nurses was 2020 batches. This recruitment exercise, I must say, is heavily guided by the objectives of free primary health care policy, with emphasis on strengthening preventive care, community-based care, and primary health care delivery, particularly in underserved areas of the country. These objectives guided by the human resource policies and operational documents of the ministry and its agencies, such as Ghana Health Service, CHAG, Ahmadiyya Health Services, and Mental Health Authority, were used to determine the allocations by professions and by locations. With that, I'm saying that by locations, that we are talking about the districts that we considered in this recruitment process. In the interest of transparency, regional locations were based on staffing norms and annual human resource requirements submitted by these agencies. Consequently, regions and districts with greater staffing gaps and healthcare needs and professions with a high impact on the sources of free primary healthcare policy received the highest allocations. I must say that all regions received some allocations, but not all metropolitan, municipal, and district assemblies were considered. For instance, if you take Greater Accra region, it's only Adan West, Adan East, and Ningo Prampra municipality that were prioritized, though other districts also got some little of these numbers, but most of the numbers went to these three districts in the region. Based on the submissions from the relevant agencies, more professional groups were also considered. However, those with a higher impact on the success of free primary healthcare policy received allocations. So traditionally, when we are doing recruitment at the health sector, you realize that we concentrate more on the registered general nurses, concentrate more on the midwives. We don't usually concentrate more on the certificates and other cadres. But in this instance, nurse assistant preventive and registered public health nurses were prioritized in this category of nurses. Those two professions got about 40% of the 6,500 allocated to nurses. The reason being that the emphasis at this point in time is on the free primary health care. And then you are going to start with the home care and home visits. So these are the priorities that we use to do the allocations this time. To further enhance transparency in our recruitment process, address the imbalances that we have in the distribution of health professionals in the country, and to support direct district level recruitment, the ministry introduced a new recruitment portal. This portal basically decentralizes the allocation to the districts. So today that we are done with the process, all of the people that have actually submitted their applications, it will fall directly to the district, and the district that will call them. The Ministry of Health will not have any role to play again. It will this that will call them, they will go to the district for their interviews. I must say that the feedback on the system has been taken into account, and then we will use it to improve user experience going forward. Let me give you a little information on the portal. This platform successfully ingested about a substantial baseline of records of about 53,440 health professionals. I don't remember that we give 1 week for health professionals to go onto the portal to verify their data. We got about 53,440 health professionals that went to the portal. Allied health professionals, those that we have on the portal currently, they are about 30,226. And this spans from professionals who qualify to work with the Ministry of Health from 2019 to 2024. Nurses and midwives, we prioritize only 2021 batch, and their number is 16,860. Physician assistants, they also are from 2018 to 2024, and they are 4,631. Pharmacists, 2,975. And then pharmacy technicians, 1,778. With CRAs, we had about 5 of them also patched. 29,893 total accounts were initiated, with 2,636 without profile creation. So when we analyze the portal, we had about 29,893 accounts were created, but out of that, 2,636 were unable to create their profile. The rest of them all created their profiles. The top cadres with active accounts on the portal currently include registered general nurses 4,150 each, registered midwives 3,503, nurse assistant clinical 1,329, nurse assistant preventive 2,724, registered public health nurses 960, nursing officer 804, medical lab sciences 2,050 each, medical lab technicians 1,546, physician assistant 901, pharmacy technicians 720, and nutritionists 1,217. These are the top of them, though we have it for all the other professions. Then I want to also talk about the traffic, the records on traffic that we had on the platform. We had about 3 of the sessions, the days that we had the highest traffic. With 5 minutes, how many numbers you receive on the traffic? Greater Accra and Eastern Region, 217 applications were submitted within 5 minutes. Ashanti Region and Bono Ahafo, 153 applications within 5 minutes. And Central Region and Western, 123 applications within 5 minutes. This gives information why, when you were recruiting at the northern part of the country, you were not having much problem, but when we started coming downwards, we were having these challenges. The top applicant group that we were recorded on the platform are the registered general nurses group, represent the highest number of applications nationwide, recording 4,158 applications. Then for the first time, the highest localized demand. For the first time, a district in the northern part of the country, West Mapusi, recorded the highest total number of successful applications, with over 90 successful applications. So the objective of us to create this platform is for us to do redistribution of health professionals. Previously, after the recruitment process, you see people trooping and asking for change to work in the cities. But this time, you made it that when you apply, it goes directly to the district. And when you look at the platform, West Mapusi had the highest numbers. And this also informed the ministry deliberate effort to allocate more professionals to the rural areas and the deprived areas. On field quotas, the registered public health nurse group finished their recruitment windows with a leftover of over 80 slots. So as we speak, we still have those slots on the platform. Additionally, all northern regions retain open on-field slots and close at the close of the recruitment period. And then the density Upper East, Upper West, and Savannah regions were located the highest number of employment openings. Then we go to the summary of applications that were received. The total self-application at the end of the main application process comprised nurses and midwives, a total of 6,245 applications out of the 6,500. The remaining is allocated to some critical areas of the teaching hospitals. I think if you all observe, the teaching hospitals were not on the platform. They were not having a slot on the platform at this process. We intentionally did that so that people doesn't keep the TCTs only. And the teaching hospital and the specialized services delivery, just such as the psychiatric hospitals. So you give the opportunity for those ones also to be filled. Allied health professionals, a total of 771 applications have been successfully submitted out of the 900. The remaining is allocated to the some critical areas of the teaching hospital and specialized services that will also be open soon. Pharmacy and pharmacy technicians, 235 successful applications were submitted out of the 250. And the physician assistants, all their vacancies were taken. The CRAs, certified registered anesthetists, their vacancies, none of it have been taken. There are about 5 vacancies on the platform currently. So as I said, we currently have available about 87 slots on the platform, which include more of the public health nurses and the CRAs. These vacancies are mainly scattered within the northern district of the country. We are therefore working with the Ghana Health Service and CHAG and other agencies that brought the needs and then the gaps so that we can either reallocate these cadres to different cadres. But then I must say that for the district that these allocations were done will never be changed. In the weeks to come, the portal will be open in the coming weeks for a mop-up exercise to clear the remaining flaws, the ones that I just mentioned. The allocations to critical areas of teaching hospitals and other specialized institutions such as psychiatry hospitals will also be considered as part of the mop-up exercise. Also, ladies and gentlemen, I want to also talk a little about the issue of fraud and illegal collections. Considering the number of health professionals who are eligible to be employed and at home, this was actually expected and was part of the ministry planning towards this process from the beginning. We actually discussed that one at length. We had meetings with the security agencies before the process actually started and collaborated with them throughout the process. Through this collaboration, the support of the public, some uncompromised persons are being investigated by the security agencies. We will communicate to the public when new developments in this regard are received from the state agencies. I might also say that we caution the leadership of the professional group to warn their members not to avail themselves to some of these corrupt individuals. And once again, I would like to use this opportunity to reach that call that whenever we start this process, we should not avail themselves because they will take your money and they will not be able to do anything for you. Then we zoom to the next test. After the mop-up exercise, the attention will be shifted to the agencies, regions, and the districts. The successful applicants will be invited by their respective districts for an interview, where their certificates and other important professional documents will be assessed. Basically, the interview seeks to confirm the documentation of the professionals and their readiness to start work. And then, after that, the professional will be onboarded to start work from 1st July 2026. On the issue of additional financial clearance, as the Minister, Honorable Kwabena Minta Akando, has expressly stated and on various platforms, we expect to receive further clearance from the Ministry of Finance for the recruitment of health professionals before the end of the year. The Ministry will continue to engage with the Ministry of Finance to secure this clearance for the benefit of our professionals at home. The recruitment portal will be reopened as soon as additional clearance is granted. I must also want to use this opportunity to inform the public that in the weeks to come, the Ministry will also start the process towards the recruitment of medical officers to fill over vacancies across the country, especially in the rural and deprived areas of the country. And then you also start the process of the volunteer recruitment that the Minister has also been talking about. So you also start that process. The volunteer recruitment will involve most of the health professionals, but basically you look at the nurse assistant preventive first, and then you look at other assistants that will help. These volunteers will be given some stipends, and then they will also be considered, they will be given some priority when we are going to do the nurse recruitment. This year, the recruitment of volunteers will cover over 6,000 prospective professionals who completed school from 2022 to date. So the 2021 batch that we are currently recruiting will not be part. The ones that we receive currently, for the nurses, we concentrate only on 2021 batch. And then we have recruited some, we are waiting to recruit the others, so they will not be part of the voluntary process. The Ministry acknowledges that more health professionals are needed to expand access to quality healthcare delivery across the country. In conclusion, the Ministry of Health remains committed to creating recruitment opportunities for all categories of health professionals as demonstrated in the current process. Quality healthcare delivery in the health sector, I believe all of you know that depends on effective teamwork across all professional cadres. our agenda, spearheaded by the vision of our minister, to ensure that underserved districts are adequately served with their respective health professionals is on course. And together with you, your support, we shall achieve this objective, which is very critical for the achievement of the country's basic and SDG targets. Thank you very much. So I think there's further information that I have to give that after the mop-up exercise, there may be other recruitment process like the doctors one and then the volunteer one, but at any point in time, applicants can go to the platform to create their profiles and then get themselves in readiness for any recruitment that will come. And then when you go to the platform and you are having difficulty in your records, if your records are not there, you can contact the ministry so that it can help you to rectify them. You don't wait till you get around before you rush into some of these things. The platform will be there, so try and go to the platform and then correct everything and be sure that all your details are on the platform. Thank you.
A round of applause for him, please. Thank you very much, Director HR, for that insightful and comprehensive presentation. Distinguished ladies and gentlemen from the press, it is now time for questions and comments. And please, yes, so you state the station that you are coming from and your name. And I'll also plead with you that we keep our questions and comments brief and concise to allow others to also ask their questions. So I think that we'll do first five, we answer them, and then we come back for the second batch. Yes. Okay. Director. What's the bottom for my Okay.
That should be yesterday. Okay, so yes, I'm money to find. Minister of Health. In your financial calendar from Minister of Finance, somewhere in April this year. Financial calendar then I pay 8,000, and the instruction was that for all health professionals. So it was distributed across all health professionals. Now, you say, certainly see I can say your health education form wolf your mobile at more than 100,000. I want to fee. The current financial currency was about 8,000. So with that you say oh far ending ubia pese unya. Nti sa a friend says I say intensity na yinya throughout the period no idea na yetiase from the beginning is a sign beba because if you nipa etifi no na do na yinya na sa and beba enti ministry no se na be ya ibenya nkofo na ma ye adwuma wo especially baby a din se nkofo be ko nkurase ene hard to reach areas no there be a year recruitment na nipa be bring ponti a wo short force no ye consider more ena ye hwe adwumayefo ne so a ankada bia se ye fa ban adwumayefo wo apomdin ha aya na ye hwe nurse omomo ewo degree no any diploma no more ba we no a year wo mo ne say the objective I want we no ne say ye say ye fan perform before if mu no ma ko hwe perform because of the free primary care enti we no ye mayeni eba omo a ye tri ni omo e wo saa ya no more
Nti sɛ wohwɛ saa recruitment wei na ɛyɛ na ɔmo yɛ community na ɔmo yɛ wei no ɔmo na ɛfa ɔmo paa. Nti wohwɛ ya na ɔmo yɛ nkurɔfoɔ na ɔmo de na ɔmo nkasa because ɔmo de nkɔ na ɔmo yɛ ma ɔmo fa ya na abɔ ɔmo so. Wohwɛ a ewie yɛwɔ vacancies ɛwɔ platform no so a still saa nkurɔfoɔ no bia a ɔmo amfa koraa. Nti na mepɛ sɛ mema yɛhu sɛ platform no adwumadi a na ɛwɔ so na ɛdɔɔso ɛno na ɛma na saa samta yɛnya saa hs no na sɛ wohwɛ professionals dodoɔ a yɛde ɔmo kɔɔ platform no so a they are over 53,440 nti wohwɛ a ɛdɔɔso paa ɛna ɛyi a current yɛnya no so na ɛyɛ about 8,000 a na yɛde yɛ adwuma nti obviously no obiara pɛ sɛ owuram na wonya nti it was not as easy at all. Saa nkurɔfoɔ no yɛhwɛ a allied health for sɛ lab ne radiology ne nutrition saa nkurɔfoɔ no ɔmo dodoɔ deɛ about 30,000. Nurses deɛ yɛhwɛ only 2021 group no ɔmo nko ayɛ 6,860 ɛna physician assistant adɔktafoɔ tɔ na ɔmo wɔ nkuraseɛ no ɔmo nso de about 4,600. Pharmacists ɔmo a yɛde ɔmo kɔ platform no so de about 2,009 ɛna pharmacy technicians 1,007. Nti sɛ wohwɛ nkurɔfokuo a yɛde ɔmo kɔ platform no so na nursefoɔ na ɔmo wɔ diploma no ɔmo na ɔmo kɔɔ so paa. They were about 4,158. Your midwives, your nurse assistant clinical, nurse assistant preventive. Nurse assistant preventive for the year. I feel your mafia. As there, as a multi-million year on do said, you know, because I not visit on price on more our platform, so that they are about I think the third on it. It is a worship. And you may be an air course war platform national. Who say, Uncle Fogo, much a mark of platform that will get your profile that. And now, Marshall that study platform now who say, a hana mepe. It will be they go straight to that and then when take that those off. Data crap, data crap. It's my 5 minutes. Applications that most of me here was about 217. A shuttle region. Within 5 minutes, about 153. In our central region, about 123 applications were submitted. In Tianona, Emma, who said, oh, yes, so I don't know, as we say, Asa. Because the whole country, and will be at the Fiena on one, as I be a cookie one place, and I say, yes, I will be a 1 by 1, will be at the computer. In the Santa Automotive will be all cry, or whose lot we are, or corporate press say. Ono echo submit we no ebia na internet no ebia na hona obi so press the same thing no matter. And that's what actually happened. So if you look at the speed, I was actually amazed when the Greater Accra one when I saw it, and within 10 minutes I think it was about 280 within 10 minutes. So it was actually competitive. That was what actually happened. Now another thing that recruitment way and information back when they are back Emma Ministry of Health and say a woman may be Ghana ha a yana recruitment adding so be young from Mako in Croatiano and another northern side of the country. In fact, the Ministry of Health I choose about 8 regions are yes or more our problem to minister and near sea. Sarah regions no say quite be a fast way being or more required number of staff. Sarah is Upper East, Upper West, Savannah, Northeast, Uti, Bono East, Ahafo, and the Western of. About 8 of them. Omona yeka apumdin adwuma yefo omona mbese no ewo from. Last time I hear doctors recruitment no so hwe ya ye start here be osome na obi anko Northeast, Obianco OT, Obianco Upper East. The minister no one in the Mojimu, and actually, yeah, numbers kaka. And this areas, and a target. Now, many said this point in time, analysis, you will say Westman Pussy. I think that's Walwali area. They are the district Omunya applicants are. The reason they said previously, no, now recruitment now, you're walking in to other than headquarters or the region. Now, HR for the entire office, I can say, we co crew issue, we co crew issue, we co crew issue. And to say, you'll be open and I prefer say, I go better than the crew, but if you put snap over for we know. Yama will be a fine so why choose to be a so yema. And if you look at it, my suspicion is that or more fast or no be or more area more. Because I make room, me young boy, I mean, I do not know make me to the make to the group, my baby, make me a baby, and be a better me feel my body. And this one is going to actually help us to also keep the health professionals at the underserved areas. Because now it's offer people the opportunity. Ubia area where our platform is so now our could choose. And they say, oh, where the opposite of our crew, where to make sure what's our crew. All like previously now, Nanka, say, you for me now, ha, ministry, ha, ya, can't be distribution, you post to be high. But this time is not posting. This one is not posting. So that is what actually happened. And sir, may you know. Yes, one more slots na work platform this no. You be platform no. And some mop-up exercise to clear those ones. And baby to say teaching hospital. We need this particular way for one count. And psychiatry hospital. So yeah, the only to be come on. Yeah, open platform no mama. Person just no more issue about fraud and illegal collections and so. Idea, yes, starting process now, we say looking at the numbers at home and the TBR, Sansum, no, Abeba, and the invited state agencies in no more meetings. So they were actually with us in all this process. But we class will be our war, Bibisa, swap, which media fire so now investigation on. If mop-up now, the Rebecca say this is not religious, or we invited professionals to interview. So that one, I will not be involved. I'm from directly, then they will go to their district and then they will have interview. And then from there, they can onboard them to start work in 1st July 2026. And additional financial clearance, so the minister can want some into a vampire say, and also you be say be a portal. Ama obia asambe apply. Me pese me use akonya we so na me can say doctors and so omo recruitment ne best starting and say ya we no na conclude we na best start doctors here no. And na omo so omo to omo nurses na especially omo time so say e be for omo this time from 2022 going omo akonya says I have voluntary scheme na aban dia ba no so betimi akosubi. And no over being bibi kakra, and you also think that also help you not to lose your professional skills. In the end, they better 6,000, and they better 2022 batch onwards. That was it.
Okay, so we move on to the questions and comments section. 1, 2, 3, 4. Okay, so I start from you, number 1.
Good morning to us all. My name is Sandra Frimpong. I'm the leader of the unemployed group. First of all, I would like to appreciate the ministry and this particular incredible position to employ. However, we have some outstanding issues that we would like to be addressed. One is the issue of the clinical nurses, the NAC. From the recruitment, we realized that they had very little numbers. Considering the first regions that were open, the Upper East and Upper West, they had only 10 slots. Meanwhile, they have the numbers when it comes to the recruitment. We tried to reach out to find out the reason why they didn't get a lot of slots, and the feedback we had, they weren't really happy with it. If they don't need them, why then keep training them? So please, we want that issue to be addressed. And then the issue of the volunteering. When we met the ministry, we the leaders met the ministry, they told us that it was going to be for the 2022 batch. But now we are hearing that it is going to be for the rest of the nurses that were able to get into the portal. We want a clarification on that one too. With the mop-up exercise, we are grateful for that, but we would wish that out of the 6,500 that was promised, all of us would go, because it won't be fair that I and my brothers and sisters would sit in the same classroom, and then some would have to take the lead to the workplace, and we would have to join them later. So please address this for us. We heard the director say 6,245 people entered the portal. We want a clarification on that one too, because the no slot syndrome was real. People went in there and there were no slots. So please, Ministry of Health and all stakeholders, we are appealing to you. Kindly address these concerns for us. Thank you very much.
Good morning, everyone. My name is Dr. Obi Joshua Payne. I'm from the Pharmaceutical Society of Ghana. I'm a pharmacist, and I'm the Employment and Regulatory Lead for the Young Pharmacists. So my question is very simple. I'd like to appreciate the ministry for giving us this opportunity and also opening the platform for pharmacists to apply. But I want to ask this. There's been a good commitment to pharmacy technicians in the free primary health care. I'd like to specifically know from the ministry that what specific quota was given to pharmacists. Because mid-year last year, the Minister of Health made an emphatic statement on the floor of Parliament that he's going to prioritize about 1,621 pharmacists. It was on the floor of Parliament. So out of the clearance for the 8,000 healthcare professionals, what was the specific quota for pharmacists? And moving forward, what will be the specific quota for pharmacists? This is my question. Thank you.
So at this point, I'll invite the head of HTI and also the spokesperson for the Ministry of Health, Mr. Tony Goodman, to answer the questions.
Thank you. The first question, why are we still training? That falls within my purview, so I can answer that. Why are we still training journalists? I'm not sure all journalists have work. Why are we training accountants? I'm not sure they all have work. Education is to liberate you from ignorance. That is the first reason. And then the second one is to get you a job. We have not said that we are not going to recruit nurses. We said we'll recruit them as and when we get financial clearance. So we have to continuously train. The other question, I remember the Honorable Minister saying that the volunteers will start from 2022. Nothing has changed. It will still start from 2022. The 2021 batch who were not able to get this particular slot, the next clearance will be part of it. So it's from 2022 and not 2021. So it's still, the plan still stands. So specific quota for pharmacists, even though I know I'll invite the director, human resource for the health development to answer that.
Yeah, so the quota for pharmacists and pharmacy technicians, I think we've communicated this one. The recent release, I think it was there, is 250. That's the number that we give to pharmacy and pharmacy technicians. But as we also provided additional information that when we are doing the prioritization also, we give the technicians 150 and then we give the pharmacists 100. For the recruitment process, it's not ending. As I just said that Honorable is still pushing for us to get another client before the end of the year. So pharmacists will be considered. I think what we have planned to do is consistently, whatever you get, you ensure that all professionals are considered. That is our objective. So that one will not change. I think minister have been saying that even if you get one, you will share for everybody to get some form of it. So that's what we are going to do. And I think I want to add something to what someone asked about the NAC. So we appreciate that the NAC, their numbers were very few. But as I said, this particular recruitment, the objective was for free primary health care. So that's why even usually you realize that registered general nurses, they will have the highest number. But at this point in time, certificate community health nurses got the highest. So it was because of the objective. It's the objective that is driving the numbers that we are picking. But I'm discussing with Ghana Air Service and then Chad to see whether the slot that we have remaining, whether we can reprioritize them for the night. Because I actually thought also, I also feel that because their numbers are huge and they were not getting a lot of slots. I think that's it.
So we do another set. Okay. Your name and where you're coming from.
Good morning. Please, my name is Ketri, and I work for Kesben Media. Of course, the bone of contention here is the low slot syndrome. And we've engaged some of the health professionals, and what they see, some of them are of the view that the portal was a mere formality, and even selection were made beforehand. That is the perception some of them have now. So I want to ask what the ministry is doing to prove, if they have a mechanism to prove that whatever they did was merit-based, so that perception could be cleared, and also the approach the ministry will want to use so that we will not encounter any of such issues in the next cycle of selection. Thank you.
So upon all the clarifications, you still think you didn't do well. All right. Who else, please?
Thank you very much. My name is Osman. I work with Recruitment. But my question is, I just want to find out from HR. Yes, I said my name is Osman. I work with Recruitment. Yes, so I was trying to find out from you, HR, like those who go on the portal to register, whether there's a mechanism that you put in place to ensure that somebody will not register in different regions. For example, in the Upper East region, and the same person doing the same in different regions. Is there anything that you are using to check this? And the second one too is, I don't know if you have a data that tells you the number of personnel that is needed in particular district, where when you put on the portal, maybe those professions, you have allocated more people to that area. Is that one what is there in the system? If not, what are you doing on that? Thank you.
Anyone else, please? Okay.
Morning, thank you very much. My name is Benadamo. I'm the Greater Accra Regional Rep for Graduate Unemployed Nurses and Midwives Association. My question is about the fact that in the past years, there's been issues of nurses being recruited and posted to their various hospitals. They work for close to a year and then they are not paid. So I'm trying to understand that is it going to be an issue this time around, or should we expect that as they do their work at the hospitals, they're going to be paid and not be delayed? Also, we understand the fact that this recruitment was based on the issues of deprived areas needing more professionals at their various hospitals. But then I also want to get a clarification on how these districts were chosen as deprived, because looking at some regions have a lower number of health facilities than places like Greater Accra and Ashanti region. So are we going to consider the fact that these places have more hospitals, like I made mention of Greater Accra region and Ashanti region? Because we are only choosing places that they are deprived and they need these. When you do the ratio and proportion, you understand that Greater Accra and Ashanti region even need more health workers. The best of my knowledge. So I want to get a clarification on that. Thank you very much. And additionally, there were issues for circulation. There was something circulation that there was a different site. Some people suppose that the Ministry of Health had different sites for their own people they wanted to recruit. So once you get a clarification, is there any way that it can be proven, or is there any clarification on that? Thank you very much.
So, how the staffing are allocated. I think in my statement I mentioned about staffing norm. Staffing norm, what it means is that, the meaning of staffing norm is that we have predetermined gaps already at the ministry, and all agencies also have that. This particular recruitment, we took the needs assessment from the agencies specifically. But nationally, I also have the staffing norm of the whole country. So I know that this is the number of nurses they need, this is the number of doctors they need. So anytime we are doing recruitment, this is what we use to determine the numbers. And that's what we are working towards to achieve. You understand? So any recruitment that we do, we don't just do it in vacuum. We use the needs assessment and the requirements. Every year, these requirements are used to prepare budgets. And it's out of that budget that we are getting this financial clearance from. So the financial clearance that we are getting is against the Ministry of Health budget, which we have determined before the year starts. So that's how it works. So all the areas and then the numbers that we need, we know them. So for instance, if you look at the community health nurses, as we speak, for us to have the full number for the free primary health care, we need maximum 12,000. Minimum, you need 6,000. And that's the reason why this time we emphasize on community health nurses. Because the numbers that we are having, we need extra 6,000. And this recruitment, we are not going to get even up to 3,000. So that's the reason why we are also considering the voluntary system to add up to it. You understand? The voluntary system, if you go to some countries, they don't use the health professional, they use local people to do it. But for us, we realize that since we also have professionals also at home and they are not working, why don't you use them? Rather to go and now pick somebody who doesn't have any idea in health, care delivery to come and do those work. So that's the reason why we did that. And then for the district that we're choosing, that one we just benchmarked on the free primary health care districts. So that was the one that was used. And that one, those determinations are done already by WHO, by World Bank, so you have those data there already. Those are the ones that they also use for the free primary health care selection. And the recruitment is based on that. So somebody was asking me, why are you not prioritizing where you went to do the launch? That place was Shy or Suluhu. But it's based on the records that we have, and then the numbers. Then someone also asked about the early payment. That's the reason why you were unable to do the 16,000 that Minister has been talking about. For us, we decided that we will not employ people for them to stay home and work and then they will not be paid. So if you realize the doctors one that we did last year, those who started in November, they received their salary in November. So the very month they started, they received their salary. So this one, we are starting from July. I can say that in July, those who report early, they will get their salary. So that's the way that we are going. We are not going to allow anyone to work and they will not be paid. Thank you very much. I think the IT people will talk about the Corona issue.
Thank you, Director. I think that if I understand the question clearly, it's about double registration. Who asked the question of double registration? Yeah. So one thing I say is that there's no way anybody can do double registration. So every applicant has got a very unique reference number. And when you apply to a specific district, it's mapped against your unique reference, which is your PIN, your index number. So the system is very much aware of a single ID that has applied for a single slot. So there can't be the option of double selecting facilities.
You want to take the missing information aspect of it?
So on the code issue, I think we've issued a statement on that, but let me clarify some few points. The truth is that when we began this whole process, various hackers went onto the portal trying to mimic what we're doing. You know the obvious reason, so that they can collect money from people. They created an account that looks like what we were using. And quickly, you remember the first day, we shut it down and brought it back. Then quickly they released theirs to say that this is a clone account we were using. It wasn't our site. We don't have any reason to have a separate account to recruit people. The processes you have seen is just transparent. If us here in the ministry is not able to help anybody, it means that the slot was put in there for outsiders to get. We have nothing to hide in this process. I'm sure the continuous statement, the continuous release of press releases should tell you how transparent this thing has been. I didn't want to add what was happening in the past. In the past, these numbers, you won't even hear it anywhere. You won't see any press release on 8,000 that we are going to recruit 8,000. What you see is that it will just be shared among people and then that's all. But because we have decided to be transparent about this system, that is why you would hear about this no slot issue. The no slot you mentioned, if you look at the number of people who go on the site, within 5 minutes, you definitely have traffic issues. You will definitely have traffic issues. So if I am smarter than you, and we go onto the portal, I will get before you. Some went there and will be going around the portal, want to see what is there. By the time you will finish that, somebody would have applied and gotten job. We know a lot of people. You said whether we have evidence or not. We posted the evidence on our portal, but later we decided to pull it down because of data protection issues. There are people, the nurses, you know your friends, allied health, pharmacists, you know those who went into the portal and got genuine job. I have been sent a lot of screenshots that I've gotten it. You know them. We have said that if somebody has collected money from you or has helped you to get this recruitment, come and report the person. We've not had anybody. Some will post and how much is secure. Come and report just a person who has collected your money or the person who has also paid the money. We don't have. I'm sure these ones are ghosts who are collecting the money and we don't have them. It's a transparent system. Thank you.
If I'm getting you right, if there's someone in the rural area who wants to apply, someone is also in the city using Wi-Fi and also wants to apply, and are you not giving the one in the city an advantage over the one in the rural area? Because I feel it is unfair. You understand? Because someone
You're not living in a rural area.
You understand? But I believe, it would affect the rural area.
So if we decide not to use the software or to use the portal, it means we'll share it here in Accra, and the person in the rural area will still be deprived. Let me tell you how it works. In our villages where we all live, we know where, when it's time for recruitment, where all of us will go with our laptops and there will be network. So if you go to our portal, what you see there is that you see the countdown. There will be a countdown up to the last minute. What that means is that it gives you the opportunity to go to a place where you can have proper network. You see, we didn't want to take anybody by surprise. That is why we started by doing the verification. Verify your PIN first. Just go. Be sure that my PIN is verified by the system. So that the day the portal will be open for recruitment, I will have the opportunity. So those things were done. Those in the villages, if I live in Alakle, I go to Amologa because I don't have them, I will get it there. If I live in maybe a village around Gaboso, I'll come to Gaboso to get it. If I live around, so that is how it is done. That is why I'm saying that maybe when they want to cry, so mostly we those from the village, we know where the network is. It's normally under some tree or around some area. We all go there to access network. It's the same thing that happens if I'm applying for police, if I'm applying for military immigration. It's through the portal. It is not shared like you're sharing cake. No. Thank you. Yes.
So actually there's evidence. The evidence that we have is that those regions outside Accra, when we started the northern regions, majority of the applications were from the northern regions. At a point, I was even asking why we are getting the IPs. When I asked them that they should trace the IPs for me to know where they are coming from, majority of them were outside Accra and Kumasi. So in those times, people were actually waiting for the southern side. So majority of the applicants that have received submitted their application in the northern part of the country, they are from the northern part of the country. And I think the whole issue is that people wanted Accra and Kumasi. That was the whole thing. I know Sandra and his group, majority of them, that's what they were looking for. They were waiting for Accra to come. But the Accra, the numbers are not much because Accra is already saturated. So we gave few numbers for Accra. That's why it created all those issues. All right, thank you.
Okay. Distinguished ladies and gentlemen from the press, we have come to the end of today's press conference. And on behalf of the Honorable Minister for Health, Kabnaminta Akando, and the entire management of the ministry, I wish to sincerely thank you for your presence here this morning. We also thank you for your insightful questions and comments. We are grateful for your continuous dissemination of information on health issues to the general public. We wish you a safe travel back to your destinations. Have a pleasant day.